So a question that comes up more and more frequently these days involves mosaicism. So what is mosaicism? Mosaicism is the presence of more than one cell line within a single embryo. So let me give you an example. You go through IVF, your embryos make it to the blastocyst stage, we biopsy those embryos, we do PGTA, and we get a report back and it says that a particular embryo is low mosaic. So what that means is there are two cell lines within that embryo. One cell line is normal, for example, 46XY, normal male. The other cell line has an abnormal chromosome. It's got an extra chromosome number 15, for example, in this case, okay? So what happens is that the testing has identified the presence of an extra chromosome, but not to the level of certainty that we know that that embryo is abnormal. So what that means is you can assume there are two cell lines within that embryo. There's one cell line that's normal. There's one cell line that's got that extra chromosome number 15. And basically what happens within that embryo is a race for survival. If the normal cell line grows faster than the abnormal cell line, you may very well have a perfectly normal embryo, perfectly normal baby, perfectly normal pregnancy. If on the other hand, the abnormal cell line grows faster, then what can happen there is that you can have potentially an abnormal pregnancy. Most likely that pregnancy will fail to attach, or if it attaches at all, it may very well miscarry at a later date. So the risk of miscarriage with mosaic embryos is higher. The chance for success with mosaic embryos is lower than with euploid blastocysts. So to give you just an example, the currently quoted chance for success with a single transfer of a single blastocyst that's euploid is around 50 to 60%. That same embryo, if it's mosaic, has a chance for success of about 30% if it's a low mosaic. So it's still worth transferring those embryos. Mosaic embryos are not something that's taboo anymore. It's not something that we should shy away from, but it does require extensive counseling with the patient, usually involving a genetic counselor as well. But then you can reach the right decision for you and decide whether to transfer a mosaic embryo or not.